Hey everybody, welcome to Ask Dr. Testosterone, starring Dr. George Touliatos, brought to you by his website, gtool.com. That's gtoul.com. That's where you can pick up this book, Bodybuilding, the Good, the Bad, and the Ugly. You can also get that at amazon.com. Joining us all the way from Athens, Greece, Dr. George Touliatos. How are you, sir?
Hello, Ron. I'm fine. How are you doing?
Good. What a weekend. What a few days we've had in the bodybuilding world. We had some bad news Friday.
Yeah.
The legendary two-time Mr. Olympia strongman Franco Columbu.
Franco Columbu passed away at the age of 78. So far, he was the oldest among all the Olympians.
Yeah.
Yes, only Frank Zane and Arnold are over 70.
Yeah.
And Sergio Oliva passed away at 70, and also Larry Scott 75.
Yeah.
So he was back in hometown Sardinia, so in a way, he ended his life where he began from.
Yeah, that's kind of, that's one good thing about it, one circle of life kind of thing.
Yeah. Yes, and I'm also moved by the way Arnold expressed his love and his gratitude to him, and all, of course, yes, he was very loved from the whole bodybuilding community. Yes, he was among the strongest Olympians ever. He was a powerlifter also, yes.
Yeah.
And, I mean, he owns his career to Arnold because he brought him to the States as his pal, yes. And the rest is history.
Yeah.
And the other one is the coming of the new rising star in the States by Rambo, the Hadi Chopin. And I hope Chopin will remain in the States long after the Olympia, not just for the Olympia, because he's the rising star, and personally, I believe he's going to do the open class for two reasons. First of all, we know the open class is the most prestigious in terms of competitors.
Yeah.
And it's the Roman arena with the gladiators, is the Super Bowl bodybuilder. Number two, because the prize awards, the winner of the 212 earns less than the top fifth of the Olympia. So it's $40K, $45,000 earns the top five of the Olympia. And for another reason, I believe that Hadi Chopin does not look anymore a 212 bodybuilder. He has developed in matters of size. I believe he was 220 when he beat Nathan Diashe in Vancouver Pro Invitational.
Hani says he was 217.
Even in this way, it's 99 kilograms. I mean, he was super good in conditioning. And I think it's kind of backwards going to 96 kilograms in 212, trying to sacrifice muscle and be less in terms of size.
Yeah.
I look up and up. I mean, this guy is progressively growing, and with 100 kilograms, I believe he can make the top five. Jay Cutler believes top three.
Yeah, I think that's possible.
Yes, it's according to the other guys' conditioning, because Hadi Chopin, frankly, is among the best in terms of conditioning.
Oh yeah.
He said his legs are ridiculous full. To the rear, he's like an anatomic chart. Okay, I don't believe he has weak. Maybe his calves are not as good as the rest of his body, but related to Flex Wheeler, he has better legs than Flex Wheeler. Maybe not as tiny midsection and V taper, but Jay Cutler believes he can beat Flex. And really, looking this
Flex Lewis, not Flex Wheeler.
I'm sorry, yes, Flex Lewis. And even if he wins 12, what's the big deal about it? Flex has 7 titles. What's the big deal to earn one?
It's an Olympia title. You could say I'm the Olympia 212 champion.
It's the mini Olympia.
Oh, well.
But,
your words, not mine.
Yeah, but I believe it's more promising to him if he gets in top 5 or top 3.
Yeah.
And then everything star rolls after this.
Yeah. I mean, I'm just excited. I don't care, honestly, which one he goes into. I'm just happy to finally.
Yes, this is
I
the big
see this
thing.
guy.
Yes, but he didn't. Why Hani Rambo bring him so far away just to do the small contest?
Well,
because he's a mass freak. He's just a 5'6", I think, and he's so packed with mass.
I think he's 5'4".
5'4" and shredded.
Yeah. I mean, if I was going to gamble, I'd say he probably will go do the Open Olympia, and it's
unless he can do the same, but would be wiser to do the Open first, because if he does the 212, then he has to eat up and he has to minimize in muscle in in size, you know. I don't know. I think just don't look the weight, because this is also something very anxious to look, and just do the open, bring what you have, and he's the new rising star. Yes.
I mean, imagine that first call out: Brandon Curry, Rolly Winkler, Hadi Chupin, William Bonac, Dexter Jackson.
Yes, amazing. Yeah.
I don't know who I must have got somebody mad because I probably didn't mention somebody that should be in that first call out. Sorry, guys, whoever you are. Anyway, but yeah, we're going to see it. We're going to see him in real life. Finally, I've been waiting to see this guy because Giles saw him at the San Marino Pro in 2017 after the Olympia when he took second place to Cedric McMillan. And, you know, he was raving about how good Hadi was. And I've been waiting.
Sargent had on muscular development, he was the spokescaster, and he said, Persians are amazing. Look out for Hadi Chopin. He's the new rising star. 2 years ago.
So 2 years later, we finally get to see this guy in real life.
In San Marino, he was a 212 competitor, and he managed to get, I think, in top 3 of Open Club.
Right. Yeah. Did he do both shows? No, he didn't. I think that was his first Open show. Am I right?
I think there was Curry and McMillan.
I think he also did like the Sharu Classic or something. He took third place in the Open one of those years.
In India.
I think so. I think he did. But anyway,
I want to talk to him. I want to talk to him.
Hadi?
I also.
You speak Farsi?
No, come on. English.
Oh, I mean, I don't know. Maybe you do. He doesn't speak English.
I want to take a picture with Brandon Curry because he's in the cover of MD. Okay. And I want to take a picture with him and introduce myself.
Okay. All right. Want to get some questions, Doctor?
Sure. Yes.
Got some good ones. Okay. First question for the doctor this week. What are some of the benefits and side effects of TRT and having Afib? Not a lot of literature out there. So this guy has Afib. And,
yes, atrial fibrillation is a kind of arrhythmia in the heart. And the worst scenario is ventricular fibrillation that equals death and flatline. Now, atrial fibrillation, Afib, as Dr. O'Connor says, he's an expert in heart issues as an internal medicine general pathologist. It's something that takes place under CNS stimulants, also under the use of spironolactone because potassium elevates a lot. And it's an arrhythmia, yes, but that fibrillation means that the heart muscle doesn't contract correctly. And in this way, it corrects pathologically. In this way, clots are formed, and these clots may occlude a carotid artery or cerebral artery, and you may have a stroke. So yes, now fibrillation takes place under electrolyte imbalance. Now, anabolic steroids are able to induce arrhythmia through this imbalance of electrolytes, and especially by retention of calcium and magnesium, because these are elements that are retained by anabolic steroids because they lead to edema, also sodium, potassium. And bodybuilders have abnormal heart rhythm because of their abuse. Now, on the other way, TRT, testosterone replacement therapy, optimizes heart rhythm by optimizing calcium levels, because all androgens and testosterone, of course, retains calcium, as decadurabolin also does, but optimizing TRT within the normal range will improve heart rhythm through this optimization of calcium channels and calcium retention. So I don't think using TRT within range, so up to 150 or 200 milligrams per week, will lead to any other fibrillation. Now, unless this guy has a problem with arrhythmias, he should be checked out by cardiologist and ECG or echocardiogram. And also he has to, perform 24-hour Holter ECG, which is you get tapped with ECG and you carry this 24 hours a day in your home also. And then the cardiologist checks it out and the rhythm as you sleep, as you take a shower every day, or the whole day. And of course, he should stay away from stimulants, even coffee. All right, because yes, atrial fibrillation may lead to clot formation, and this clot may lead to thrombus, occlusion, embolism.
Wow. So really, no side effects being on
You shouldn't
TRT.
touch also steroids, because steroids, by using them superphysiologically, because nobody will use 50 milligrams of DECA per week, then they will create an abnormal levels of calcium, magnesium, and all these electrolytes that have an impact on the heart muscle.
All right, cool. All right, good answer, Doc. Thank you. Next one. Could you speak more about TRT and HCG to maintain fertility? What dosage in general? Do we have to add Clomid? Thanks a lot for sharing of knowledge. Best regards from Marseille, France.
Yeah, we have said that before. Now, HCG may be used alongside with testosterone as an HRT protocol in order to restore fertility and keeps testicles and scrotum full in size and diminish atrophy and shrinkage. Personally, I have tried this for 3 years in a row. I was using small doses of HCG, 100 IUs every day. Now, the other way to use it is 250 IUs twice a week, or once a week, 500 IUs. Now, John Critfield used to say that you should use HCG the day before your weekly or double weekly use injection, because the day before, your testosterone level are supposed to be minimized to the lower, so HCG will give you a lift. But anyway, it's a good idea to introduce HCG not just for fertility purposes, but also because HCG is helping the whole steroidogenesis and hormonal environment by creating pregnenolone, progesterone, and DHEA. So it's beneficial for the user, even though he doesn't care about his sperm production.
Oh.
Yes, also other benefits as well. A better, a more optimized and improved hormonal environment.
Oh. I mean, I never heard of anybody using it except during a cycle, unless they were worried about maintaining fertility. And then a lot of guys use it, obviously, between cycles as the part of their PCT. But
yes.
Yeah, I didn't realize it had those benefits during a cycle.
Yeah, Rich Piana was not in favor of using HCG along with your steroid cycle, but afterwards as another part of PCT. But when steroid cycles are very long, then you can introduce it in order to get out easier from a steroid cycle and recover faster.
Cool. Good. It's news to me. Okay, here we got some liver value questions. Question: what ALT and AST numbers are too high, and what should the max be? Any good supplements you like for protection of the liver, like TUDCA and TAD 600?
Well, I think the ranges may vary, but of course they are too digital, okay? Some labs give them up to 40, other up to 70, but I believe up to 50 is something fair to have. Of course, they are affected by CPK or rhabdomyolysis. And what is more important than liver enzymes and transaminases, ALT, AST, or SGOT, SGOPT, are the cholestatic enzymes, alkaline phosphatase, ALP, or gamma glutaminotransferase, GGT. These are the cholestatic enzymes that reveal any intrahepatic damage and occlusion of biliary ducts that, when bile afterwards elevates, and you have jaundice, okay, of the sclera and of the skin. And bilirubin, of course, elevates. So the liver enzymes, it's so-called the pharmaceutical hepatitis, can be induced by excessive training, also by painkillers such as paracetamol, also by taking too many amino acids, because amino acids are broken down in the liver, the deamination process, and this can slightly elevate. If you take, for instance, 10 tablets of liver aminos with every meal, you may have slight elevation, but this is not pathologic. When I was a resident in pathology, in biopathology and pathology in the hospital, believe me that pathologists wouldn't care about liver enzymes unless there are 3 digital, okay?
Wow.
So don't be obsessed and maniac and paranoid about, my transaminase is 52, not 74, 47, okay? There are even more serious things in liver health, yes. Mind that we are not ordinary casual individuals, that we overtrain, and because skeletal muscle, myocardium, and And the liver enzymes possess all these three organs, common receptors for these enzymes. They're also interacted and affected. Now, according to the liver health, we may use glutathione injectable, not peros because it's destroyed in the stomach, NAC and glutamine in order to form this. Also, we may use milk thistle, also or silymarin. Also, there is a blend of herbs from India called Lifted 2. Now, TUDCA, these bile salts are able to lower cholestasis and jaundice. So unless you don't have cholestatic enzymes and yellowish appearance, there is no need to use TUDCA. So you need high GGT, ALP, and bilirubin in order to take TUDCA. Yes. And also alpha lipoic acid is a potent antioxidant. Stay away from alcohol use, of course. Yes, these are basal facts, yes.
You mentioned painkillers. Is Tylenol something that really wrecks the liver too, though?
What'd you say?
Tylenol, which a lot of people use, which, what's the chemical for Tylenol?
Acetaminophen.
Acetaminophen, yeah.
Yes, this is the paracetamol we have in Europe.
Oh, okay. It's a different brand name.
Actually, 4 grams a day may able to give you a liver failure. 4 grams. Now, you can use 1 gram, 500 milligrams twice. Now, if you use 4 grams, you're rushed to the hospital with liver failure.
Yeah. Yeah, that's, I think, one of the top emergency room visit reasons in the United States is Tylenol, liver damage from Tylenol. Okay. Next question, doctor. What if you are just on TRT or want to look good and not abuse roids, just maybe go a bit high from time to time? So I guess he's saying, is it okay for people who are on TRT to blast every now and then?
This is what I do. So for 10 months in a row, I follow my HRT, which is TRT. I use DHT Proviron because we have it in order to improve my free testosterone and whatever benefit comes out of it, and DHEA. And along with, now this I keep it for 10 months in optimized. And now for 8 weeks, for 2 months for the summer, for instance, or a special occasion, I add 50 milligrams of DECA, for instance, per week, or 100 milligrams of Primo, maybe. That's light anabolics, okay? So yes, you can slightly deviate, but for a short period, in order not to destroy your lipids and your liver enzymes, and mainly lipids. And a better way to introduce yourself, DECA or Primo or any other anabolic, is the way you're using testosterone within replacement therapy. So instead of using 50 or 100 milligrams once a week, you can introduce this dose every day in smaller quantities. In this way, I believe that you have minimized liver stress, DHT response, E2 response, and also maybe to the lipids, a lesser damage.
Yeah, I mean,
but the problem is the daily pinning, but I'm familiar with that. I don't have any problem. I choose shallow intramuscular injections in my delts with an insulin syringe. Okay. Yes. That's it.
Yeah, you and Dr. O'Connor are both many times, you know, there are a lot of benefits, and you can reduce a lot of risks by doing a lot more frequent injections. It's just,
of course, in replacement therapy, this is the new deal. Instead of shooting 250 once a week, split this in a lesser doses, more frequent, in order to have stabilized levels, and more important, avoid fluctuations of E2 and DHT that you know, the major players in aromatization and erythrocytosis.
All right, Doc. Yeah. We have a multi-part question, so I guess I'll start it and then give the questions of this gentleman one by one. So I tricked you. It's one question, but it's really got 3 questions within it. Okay, so first of all, thank you, Ron and Dr. T, for an amazing show. I have a problem. I'm currently on a cycle with 300 milligrams of trenbolone and enanthate a week, 100 milligrams of Masteron enanthate per week, 100 milligrams testosterone enanthate per week, 1.5 milligrams Arimidex per week. Maybe, I don't know if that's a total or if he meant to say daily. Because Arimidex, you don't take that once a week. Okay, so then he says, I'm 4 weeks into the cycle and I've started to develop gyno. Puffy around the nipples, no pain, no liquid. My questions, number 1, is it even possible to get gyno on this cycle, or do you think I got fake drugs?
Yes, good question. Now, we can speculate that this guy, maybe the steroids are fake. In first place, when a guy comes to my office and says, I'm afraid I'm having gyno. First of all, we take a look at it, and then we touch it if it's sensible. But the most important is to undergo the lab work of estrogens, E1, E2, E3, and prolactin also. So histione, estrol, and beta estradiol, and then prolactin. And this, he said, is dry, no liquid. It means no production of milk under prolactinemia. Now, even though some guys have within range normal the estrogens and the prolactin, I suggest them to have a look by a general surgeon because the mammary gland has to be removed. Okay. Also, gynecomastia, it's also referred when there is a lot of adipose tissue in obese men that do not train and they undergo liposurgery from plastic surgeons. So liposuction.
Right.
Now, this guy that he's using 150 milligrams of, among these agents, the only one that aromatizes is the testosterone. So 150 of testosterone is hardly likely to aromatize.
He's only on 100. 100.
Yeah, 100. So I'm guessing that his trenbolone, which is an expensive drug, maybe it's faked by DECA or equipos or even testosterone. And the other one is Masteron.
Yeah.
Another rare drug, that Masteron. And why Masteron amphate? Usually Masteron is propionate. So if it's an amphate, maybe it's also testosterone amphate. So this guy is injecting more testosterone than he really believes. So
he might be injecting 500 milligrams of testosterone a week.
Yes. So this is a way to determine if you are injecting the real deal. Check before estrogens and check afterwards. So in this way, tren may be faked by DECA. If E2 and prolactin, if E2 is elevated. Now, if you're injecting Primo and E2 is elevated, Primo is faked by testosterone also, or by equipos. So yes, there are, yes. So either if this guy is cheated by the dealer, he has to calculate the estrogens, the prolactin, and then decide what to do. If they are still normal, then he has to take to be viewed by a surgeon in case of surgical removal. Yeah.
Okay, because his next question was, what do you recommend me to do? Lower the dosage of any of the steroids, increase anything, add any other drug? We don't really know what he's getting.
Well, check out 1, 2, 3 prolactin, and afterwards go to a general surgeon. And yes, if they are elevated, of course he should increase his aromatase inhibitor. Okay. Yeah. And maybe add a dopamine agonist like abergonin or bromocriptine to lower his prolactinemia.
Okay. I should probably finish everything he was asking. How can I reverse the gyno? I'm on a decently clean diet, nutritional, timing-based, high protein, high fat in the mornings and night, high protein, high carb around workouts. I'm normally on TRT 150 milligrams testosterone enanthate per week, but approximately twice a year I do an 8-week cycle with some other drugs like now. I'm very moderate, have never been over a total of 500 milligrams a week when I do my cycles. So for reversing what little gyno he has, if that is gyno that he has, if he catches it early enough, would these anti-estrogens be able to reverse it?
Yes, and especially if you add a SERM along with an aromatase inhibitor, you may be able to cut off the circulating estrogens and the new production of estrogens. And also, by following keto diet, he may lower any kind of water retention. So this might also slightly help him.
Yeah, keto diet. Not a fan.
Sorry?
I said I'm not a fan of the keto diet. I love carbs.
Yeah. And also quit these agents and try to use some other ones. Okay.
Last question is a human growth hormone question. We always get one, it seems. Dr. T, I'm running HGH 5 IU a day, split into 2 shots, morning and afternoon. When I wake up from sleeping, I've been experiencing severe carpal tunnel syndrome in my hands and forearms. Do you know why it happens? Is there anything I can do to avoid it?
Yes, we have said this before. Carpal tunnel syndrome is a classic side effect of legitimate growth hormone use. He should be happy by having
That's right.
because it works. Okay.
You didn't get scammed.
Now, why this happens? As I said before, growth hormone leads to edema and to retention. That's why we stop the use 1 or 2 weeks before the show. Now, edema costs. There are 4 tendons, superficially 4 tendons deep in the wrist. Okay,
Yeah.
between them lies the median nerve. Now, when these tendon sheaths are swollen, okay, the median nerve is compressed, and we have this feeling of numbness. Okay, the same happens to people who typewrite a lot and use the mouse. So if you go to the bank, there are some people wearing this, to the wrists. Now, really, he has, in the long term, what happens is you need a surgical procedure to cut off this transverse ligament.
Yeah.
And in my book in Greek, I have shown this surgical procedure. It's very simple, but basically is the environment here is too dense and it has to be decompressed.
Yeah, I remember years ago when Lou Ferrigno was making his comeback in the early 90s, he had to get that surgery.
Really?
He has
growth hormone, right?
I mean, I'm not saying Lou Ferrigno ever used growth hormone, but he certainly did have very severe carpal tunnel. You know, my wife has never seen growth hormone, and she's got carpal tunnel syndrome because she's been doing jobs where she's been keying in numbers for years. So it happens. All right. Well, that is all the questions, doctors. Doctor, we are only 10 days away from the Olympia now.
One more episode.
Yeah, one more episode, and then hopefully we'll do something live from Las Vegas.
Yes.
Yeah. Still no word from Dr. Thomas. Are you coming, Tom? Come on, let us know.
He told me he's too busy.
That's too bad. He is very busy, I understand. But it would have been cool to have him out there. But we have Dr. T all the way from Greece. I mean, you know, that's a little longer trip to Las Vegas from Connecticut. Greece is, you know, I don't know how far away it is, but it's pretty far.
18 hours, yes.
Is it 8-hour flight? Or 18?
18
hours? Oh my goodness gracious. How many flights are you taking?
2, New York City and then...
Oh, okay, that's not bad. That's not bad. So Athens to like France or something? Athens to Paris or something? And
no, Athens to New York City.
Oh, okay. Okay, and then to Vegas. That's not bad at all. All right, cool. Well, Doctor, I look forward to meeting you in real life pretty soon.
Yes.
And we'll definitely get some good content live direct from Las Vegas at the Olympia weekend. It's going to be a good time.
Yeah.
And you know, some of you guys out there, if you'll get the chance, hopefully, you know, you're not going to be at a booth or anything, so they're just going to have to get lucky and see you walking around, I guess.
I want to have the chance to meet with you, Rich Gaspari.
Not a problem. Not a problem. We'll track him down. He's at his booth.
And Steve Black.
All right. Well, the Olympia countdown continues. We got one more show, guys, so please keep your questions coming. You can leave them, if you're watching this on the Muscular Development YouTube, you can leave them underneath the video in the comments section, or go to the Noble Forum on musculardevelopment.com. We have a sticky thread called Questions for Dr. T that we leave up there for anybody to post questions. So 2 ways you can leave questions for us, and the doctor will be kind enough to look them over, and we pick the very best ones. So, Doctor, thank you very much for your time and your expertise, as always. Again, everybody, pick up a copy of Bodybuilding, the Good, the Bad, and the Ugly on his website, gtool.com, gtoul.com, or on amazon.com. Thanks for watching Ask Dr. Testosterone, and we will see you next time.